Have you been told that you have an anterior placenta? I know with my first baby, that's what they told me. And at the time, I had absolutely no idea what it meant. And I just received a question from a family in the Birth Toolbox class about this topic. And I want to answer the most common questions about anterior placenta. I think you're going to be a little bit surprised by what some research says about who is more likely to have an anterior placenta. Okay, let's dive into it. What is an anterior placenta? Well, it's when the placenta is attached to the front wall of the uterus. Your uterus is kind of like a balloon. It starts out small, and then as the baby grows, your uterus grows. Here's your uterus. If you have an anterior placenta, your placenta is located on the front side of your uterus. Here it is on the front. If you had a posterior placenta, it would be on the back. So it's on the back of you, right? If you have a lateral placenta, your placenta is attached on either side. So I'm turning it right to the side. So your placenta is attached either here or here. You might have a fundal placenta, and that's when the placenta is attached at the top, right there. Now, if you have a low-lying placenta, that's when the placenta is attached near the cervix at the bottom. That's also called placenta previa and can lead to the need for a cesarean birth. More in another video. So we have the placenta is inside the uterus, but it's on the side right up against your abdominal muscles. So the baby, when they're kicks the placenta first, and then you feel it in your abdomen. So when the placenta forms, it is where the egg, the fertilized egg, implants in the uterus. So it can be anywhere. It can be front, back, top, bottom. Not really sure why people aren't told the position of their placenta unless they have an anterior placenta, which is why I think sometimes when you get that information, you feel like there's something wrong with it. But it is normal. And so it kind of frustrates me when I hear people being told that they have an anterior placenta without that follow-up language, like you have an anterior placenta and it's normal. That would be my immediate follow-up statement, but that's okay. It's also common. So published estimates are right around 33% to 50% of pregnancies have an anterior placenta. Now, if you're wondering if an anterior placenta will affect your pregnancy, that's a great question. And it's going to affect the experience of baby's movements. So baby's kicks, how baby rolls around. Sometimes you'll see people take videos of their stomach, like they'll post it on Instagram, of their belly just kind of moving around, these huge kicks and movements, almost looks like there's an alien in there. If you have an anterior placenta, you're not as likely to see those big movements and feel those big kicks because baby has to be punching through the placenta. It's like a buffer. It's a physical buffer from their movements to the way you feel it on your outside abdominal wall. Now, you might feel the kicks more on the side where the placenta is not. So that is a difference, though nothing concerning about that, just a little bit of a different experience. You also might see during your visits to your care provider that when they do the fetal doppler to try to get baby's heart rate, that they might have a little bit more of a challenge to try to get to it because they're having to listen through the placenta. Now, having an anterior placenta, you might have a situation when you're in labor where the anterior placenta leads to the baby being in an OP position, or a sunny side up, occiput posterior position. And if the baby is in that position, you could experience what's called back labor. So that's when contractions are felt really intensely in the back. That's not a guarantee, but it could lead to that. Now, there's some like old wives' tales saying that an anterior placenta means you're more likely to have a girl, but that research doesn't seem very strong. And also do know that because you have an anterior placenta this pregnancy, each pregnancy is different. So the fertilized egg implants where it implants, and it's not always the same place with each pregnancy. So I, for one, had 2 pregnancies with anterior placenta and 2 without. So who knows? Now, one study showed that if your blood type is O positive, that you're more likely to have an anterior placenta. And another small study said that Sleeping on your stomach after conception may have something to do with the fertilized egg implanting in the front wall of your uterus, leading to the placenta attaching there. And is anyone out there a stomach sleeper like me? Let me know in the comments. I think that's pretty wild, but more research is necessary. Now, if you like this rapid answer to your questions, then I know you'll love the videos in this playlist where I'm answering some of the most common questions that arise in pregnancy. And I'd love for you to subscribe for more information so I can help you along in your journey. And I'll see you next time. Bye.